To understand a pneumothorax, we do have to have an understanding of the lungs and how they function. This is just a brief overview of the lung and where it sits. Obviously, we know the lungs are within the chest cavity. The chest wall is lined by the parietal pleura, and then we have a little space called the pleural space. There is a small amount of fluid in this space which we do need for normal respiration to occur. Alongside that is the visceral pleura, and this basically protects the lungs. So that's the anatomy that we're going to focus on when we're talking about our pneumothorax. So let's have a look at normal respiration. The pleura, as we've just discussed, does have a small amount of fluid, and it also has a vacuum. And this vacuum effectively keeps the lungs sucked up against the chest wall. It is the vacuum that enables us to breathe, for those lungs to inflate and deflate, keeping a seal and allowing gaseous exchange. Expansion of the chest cavity will result in a decrease in the pressure, and this will draw air into the lungs. Now, when we have an open pneumothorax, we actually have a penetrating, say, wound or an area where the air can get from the outside into the lungs. What has occurred is that vacuum that we rely on to allow pressure has now been basically ruptured. It's no longer there. And as the chest expands, air is sucked in through the hole in the chest, and the lungs are not able to expand properly, and they're very poorly ventilated. An example of this might be a cat that's been attacked by a dog, and the actual tooth has gone through the whole chest wall. So although you may see the chest rising and falling, there's no actual gaseous exchange going on. Those lungs aren't inflating and deflating because the vacuum has been broken. In a closed pneumothorax, we do not have a wound penetrating through the chest wall. However, that vacuum within the pleura and the lung has been broken by a hole in the actual lung itself. This hole in the lung allows the air to escape. As the chest expands, air is sucked outside the lung, and this prevents its proper expansion. As the animal exhales, so breathes out, the air re-enters the lung and escapes through the bronchi again. Once more, you may see normal chest movement, but we haven't got that vacuum for those lungs to work, so we are not achieving proper gaseous exchange. Now, the tension pneumothorax, this really is one of the most life-threatening pneumothorax categories. And what's happening is we have an injured area of lung, and it's effectively acting as a one-way valve. So when the animal breathes in, air is sucked into the pleural space. And when the animal breathes out, insignificant, so tiny amounts of air return. And what happens is we get an increase of air between the lung in that pleura, and the lung will eventually collapse.